topic's local crime prevention, communities creating safety in principle and practice. You see, I'm going to kind of cover some of the principal questions. So I'm an M&E specialist by background, but I want to talk about challenges to communicating local safety needs. And then John will come in and come out with 3 examples of creating local safety, and this will hopefully stimulate us into conversation. And then we have these 5 challenges, or I've written down 5 challenges that I think we have in communicating local safety needs. They all sound so simple. They always sound like we should be able to answer these so easily. Like define community. You know, how do we define community? Sounds simple. Certainly a simple question to ask. How do we define community safety? How do we communicate safety needs? And how do we, if the community does speak up, how do we document the very local safety vision? And then how do we measure the achievements? So I'm going to start out by cover each one of those. And challenge number 1 is defining the community. I think we can say, you know, each community is a unique mixture of people, cultures, resources, safety problems, and services. But what is it? And who defines it? This becomes a big issue in South Africa. The term community seems to be needed, but it means different things to different people. And we could ask, and in some places this actually happens, I can think of Switzerland maybe, where communities can define themselves and network with government over their safety needs. This might be one model, but I think self-definitions encounter huge problems in South Africa. We've got so many politics around identity and who people say they are. Planners like to work with large areas. They don't want to work with little small areas sometimes. Then we've also got this problem that's rather big, a lack of capacity at the local level sometimes to engage, dependent on your community. And then no mechanisms to really engage them fully. How do we find out what this local place that calls itself Simonstown, let's say, wants? A clue to defining community might be communication. I see they both start out with the same Latin root. And com means connected, munis meaning sharing and giving, connected to sharing and giving. And notice when it says connected to sharing and giving, that doesn't mean that the community is isolated and all by itself and doesn't talk to anybody. It's about that community connecting to people who can deliver services. So government, business, civil society, and other stakeholders, they really hold the expertise and the funds to deliver. But the community seems to know best about what's happening in that community. And so the gap is often good communication from the most local level, upward and back. And I think we have to bridge that gap. I think that's where community safety is in South Africa. You can disagree, but I think we have to bridge that gap and make it more fluid. Certainly local safety can't mean, okay, community, this is your baby, take care of it. And I think if we do that, then we see vigilantism, we see violence, we see protest, and we have seen these things. So a working definition maybe from a safety perspective is a fully integrated, fluid, two-way system, or maybe multi-system, maybe I should put multi-system, of communication from the most local level to partners found at municipal, provincial, and national levels who can respond to local safety needs. You think about it, SAPS is a national department, but they have a local presence and they can respond to safety needs. The next challenge, I think, is how we define community safety. This can refer to some of the paradigms that we employ. Originally, we only just talked about law enforcement. It wasn't that long ago, maybe 70s or early 80s, people just talked about law enforcement. You broke the law, arrest this person. Then we started getting into the whole new paradigm, crime prevention. We can actually do things in our society to prevent crime. We can start clearing fields, and we can have neighborhood watches, and we can do lots of things that teach the community about how to prevent crime as well. And then about the same time also we came up with the concept of community safety, because if you look at the term crime prevention, I'll get into this, it's like trying to prevent something we don't want. Community safety is a little bit more broader in some ways and can include more issues. First one just including crime. Then we have a public health, a healthy community perspective. This also has come into the fore, and we also hear people discussing these paradigms. Each paradigm, I could even add another one, I think, restorative justice, if you like. That's also an emerging paradigm right now, or we can lump it under public health right now, but it really is kind of a different thing. But I don't want to discuss each paradigm. What I want to say is there are paradigms. And how do we define community safety with all these different paradigms? If you look at law enforcement, what was the problem there? The problem there was it might not fit with local definitions of safety. It doesn't mean we do away with law enforcement. We need law enforcement, of course. But that term doesn't always fit with what communities need. To some, you find, if you go and ask people about safety, do they say it's about police, courts, and jails when you get down to the community level? Often not. Very surprising. They say, safety to us is a creche. We need a creche in this community. If we don't have a creche, I can't go get a job. If I can't go get a job, I can't take care of my kids. My kids might turn to crime. Please help us, get a creche. So sometimes safety is not just about police, courts, and jails, and it's also about getting in touch with what each community envisions, wants, and needs. And also, I think a lack of engagement with that has created some of our civil strife. On crime prevention, and I've already mentioned it, it's really a negation. It looks at what communities do not want. Served us well for a long time, and many people come from crime prevention backgrounds. I started out that way, but I think I'm moving away from that. But it's a negative paradigm that can sometimes promote complaints forms. You get together with the community and you say, "What don't you want?" Let's talk about the things you don't want. Then you lose key actors if you focus only on crime. And what about health, water, schools, and recreation, and social development, and food security, and all these things? A very good project I worked on just helped provide a community with a garden. It was placed in Ngongolese way. And putting that garden in really helped create safety in that community. They were able to feed themselves. So which paradigm should we use when we define community safety? Here's an interesting thing. I worked recently with the Open Society Foundation and the Department of Community Safety. They had a project called the Crime and Safety Project, and they tested this out in Orange Farm, Nomhumalelo, and Elsie's River. And they were just trying to look for local mechanisms. And they found it was difficult also to find the local mechanism where people could speak on their safety needs and then bridge the gap. But they did this in 3 different places and modeled this. And their work looking at that and how to provide for, they created little forums and so on, and people could speak out on their issues. They developed safety plans and this kind of things, monitored the safety plan. But what I want to get to is, I'm talking about paradigms. What they found was that a positive pro-social definition of health and safety brought more stakeholders to the table. And that's the key thing I'm talking about. So, and then you could bring all these different role players together. How do we create a healthy community? And then suddenly you have more people at your table. And we have to also find out, we can't assume. Oftentimes we want to assume, this is safety, we're going to deliver it to you. And then you find out it's very different on the ground. And local safety concerns might be an open field, for instance. Now I want to talk about mechanisms for communicating safety needs. I don't know if there's a gap here. Well, there might be a gap, but we certainly have no shortage of mechanisms. Maybe they don't talk to each other so much or so neatly, but we have a lot of mechanisms, and I haven't even listed them all here, but we have 6 district planning areas provincially. We've got integrated development plans and forums where safety gets discussed, but maybe in a big, large developmental context. We've got 24 municipalities in the Western Cape. They're quite big. They're not going to bring in your local community voice that well. We've got a dozen or so community safety forums. This is new evolving policy. 150 community police forums with policing areas, policing sectors, 151 station areas split into sectors, and thousands of neighborhood watches. I think there's 571 in Cape Town alone. And so this is the kind of structure. We have these large planning areas and these different regions and municipalities. If we take the Cape Town example, this is just more examples. We've got 1 council, 24 sub-councils, 111 wards. We've got ward councils. These are advisory, mainly, but they meet at least quarterly. Don't know if they can cover all the safety needs efficiently. So here's our place in our large area, 2,445 square kilometers, 4 million people. So then we have another phenomenon here we have to look at is we have hundreds of settlements with no official identity, but these are generally places with some sense of cohesion. But oftentimes they're either split over wards or wards are combined into them. But I think you very rarely hear people say, "Hi, I'm from Ward 51," and come visit me in Ward 51 and have tea. People go, "What? Where is that?" But people can say, "Longa," "Yeah, okay, I'll be there." Simonstown, we can say Misty Cliffs, we can say Ocean View, and people go, okay, I know where that is. But a lot of times these settlements, with a sense of place of cohesion, they want to speak out and they want to speak about their safety concerns. So there's not always necessarily a structure or a formal structure there. And so in Cape Town we have 50 plus nominal communities all over at various sizes, but they kind of give our sense of place. So the bottom line is we're not so short of official mechanisms for discussing safety needs. They're there. The fluidity of communication between official mechanisms and the local place might be more challenged. And what I mean is it's the gap from the very, very local level of how people define and think about their places. And I can talk about an example. There's many examples. I'm just pulling one up here. The community safety forums. These have evolved quite recently. There's policies still evolving on this, and I'm pretty sure there's other people here that know a lot more about these. But they are specific to communication on safety, and they have stakeholders with clout on them. It's always a good thing. People can actually do something about safety problems. It is new policy and practice. It is evolving, but it has the potential to take a lot of current realities into account because it's happening now. Maybe some it has some disadvantages. The areas are very large. And representation can change from meeting to meeting. You get that changing faces syndrome. And these big forums, sometimes they run the danger of becoming big discussion groups with not much action planning. But maybe somebody can speak to that here. Maybe people can talk about that. And I had the idea, can sub-forums to those form communication links with the very local communities? Could that evolve? Would that create a system of accountability? That's the kind of stuff we want to think about. How do we get to that very local level of safety? Do we have alternatives to forums that are maybe too big and wards that maybe have too little clout on safety, particularly? Well, departmental representatives can work with communities to identify their safety needs, and certainly we have police stations in every area, so we have social workers there. The problem sometimes is that we have a low ratio of representatives to the population needing services. So that I think this figure is low, really. One social worker for every 10,000 people. Somebody from the Department of Social Development can tell me. I don't know, but maybe it's even more, like 1 to 15,000 or so. I can tell you about a project that I worked on with the NPA a few years ago. I think it was 2000, maybe 2006 to 2009. I just put that in there because I'm doing it from memory. I'm getting older, memory getting shoddy, but it was right in those years. But prosecutors in 8 very high crime areas were sent out to these spots like Galashewe, high crime spots mainly, but we also had a rural area, Kudumane, we chose as our rural area. There was a lot of cattle theft, and anyway, we had 9 provinces. We started out with 9 pilot sites around the country. We ended up with 8 because one of them didn't work out, but they were all over the country, and we actually saw crime drop and safety conditions improve in the targeted areas. Because so often people say, oh, we're still searching for the model. We don't know what to do. We don't know how to stop crime. In my opinion, being an evaluator, a guy that runs around, does M&E and evaluates programs, I'm like, well, that's not right. No, there are lots of solutions. We don't implement a lot of solutions. And maybe it's because we make mistakes in our pilots. And I think this one we did kind of not see it all the way through. But we did show that by putting a senior prosecutor into a community, seasoned, intelligent person, that they could network with all the various branches of government and the community. They were like the ideal person. This model came from the United States, from Holland, where they still have it. We dropped it. They still have it in England. They have it in Holland, a few places. But we also saw, hey man, this thing works. And it worked because of this really good communication. The prosecutors met with the communities. They go to their community police forum meetings or set up another forum, and then they'd also observe conditions on the ground. We had a guy named Sunil who was in Point. He'd drive around and go, whoa, this situation is not right. This light is out here. I'm calling somebody up and getting this light fixed right now. And people come out from Public Works, wherever it is, for lighting and fix this thing. And so that rapid response I found quite impressive. And they organized raids and had overgrown fields cleared and all sorts of things. Shabeens closed down. And Windsor East was a great example. We saw that place go from really hectic-looking area to really cleaned up. I don't know what it looks like now, but at the end of our pilot, it looked really great. We also did it in Sia Shlala, here. I wouldn't get out of the car and take photographs and see a slalom. I was doing a baseline study. I would not get out of my car. We found dead bodies in a dumpster. I wouldn't get out of my car. At the end, I was walking around, visiting the creche. So this thing really worked well. But our problem, sustainability. Sometimes we go ahead with our programs and we don't say, how's this thing going to be sustained at the end? Very important question maybe to ask first. So we had 8 senior prosecutors employed for the pilot, and they were really missed by the MPA. We had to give them back. And it wasn't sustainable, but it showed us that something can work over like a 3-year period. I'll talk about one more example of something that really worked well was in Tanzania. I was sent up to review this one. It's called Sungu Sungu, means Red Army ants. And you have to bear in mind they have a civilian militia in Tanzania. But they won the UN Habitat Award for Innovation and Providing for Human Safety. Again, my memory, I think 2006, 2007, somewhere in there. And I was part of a team of people running around Africa, about 7 of us running around Africa, reviewing. Each of us we got 2 countries each. We ran around, found these examples, and communicated them to the United Nations that used the data. But there you are, the Red Army ant. And the idea is that the interesting thing about this is the poor country. So their solution wasn't based on money, because people are always going, we need, I gotta wait till we have the money. We can't do anything till we have the money. Well, they were just 10th poorest country in the whole world. And maybe not having any money was good, because they had to come up with one simple but efficient system of communication. And what they did with the Sungu Sungu thing was that, look, they had neighborhood watches. You have to bear in mind this is a neighborhood watch system. I'm not saying we can duplicate this here. Please do not say Richard Griggs said we've got to duplicate Sungu Sungu here. Not saying that. I'm saying we can learn from the example. So it was a 10-cell system for a neighborhood watch run by the civilian militia. So every 10 houses has a leader. This guy might be a sergeant right in the militia, who then reports to a leader of 100 houses, like a lieutenant. And then the 100 leader reports to the leaders of 1,000 houses, like a general. And then it just runs all the way up to the president. And pretty soon somebody's giving a presidential report. And the president says, fix that. And it comes right back down the channel. And they moved and they cleaned things up. They got equipment and supplies. They didn't have a lot of equipment and supplies, but they got equipment and supplies that they needed and so forth. So they had this 10-cell system running from the very local community on up. What I like to do, point out, is what an elegant system. May not be, I'm not saying we do, I'm just saying it's elegant. But getting back to our situation, our challenge may not be a lack of structures, but not having this kind of fully integrated system of communication. You see how the Sungu Sungu is just a complete integrated system of communication. So do our safety planning bodies talk to each other effectively? We have to ask that. That's a question to ask. Do their decisions really reflect safety needs as perceived on the ground? And maybe most importantly, do people on the ground feel consulted, like a safety plan is in place for them? We're always having this problem, showing up with our toilets and then getting a riot because that's not exactly what they wanted in their communities and how they wanted it. So mechanisms for communicating safety needs, how do we capture that vision? If we are going to consult the community, how do we capture that vision of safety at the very local level and then integrate that thing into the community safety plans? Often, I've been part of this, often you find experts at higher levels, Mr. Richard Griggs, will you come and define community needs using an audit? Will you run workshops and so on? And then we take this information from the community. But we often sometimes make the mistake of coming up with a kind of technocratic vision for that community that trumps the community's actual vision of safety. We've got one idea, we're imposing it, and the local vision is very different. And serious safety problems can result from that. Now, one of the things that's done by the Community Prosecution Pilot Project as a mechanism, I'm real enthusiastic about. So you have to apologize for my enthusiasm, because I have other methods of consulting with the community. I'm a geographer by background, so I apologize for that too. I love maps, okay? And we took simple outline maps of the community. This would be in the community prosecution thing, just issued them to the community. I remember going into the local municipalities and going, can you please give me just a basic outline map of this place, showing, where all the stores and the shops are and the blocks and so on. And then we gave them to the community and they mapped their own health and safety issues. Then we gave them all to the prosecutor and he used those to address crime issues. the interesting thing about that mapping is that from the least literate to the most literate can map. You don't have to have any special skills. So that means everybody comes aboard. Very, very good. And for me, perfect baseline data. Loved it. And I also had the evaluation data at the end. So I was able to take my maps and I go look, map A, it had all these shebeens that were like operating illegally, one of them next to a school. Now look, that shebeen's gone. This field is cleaned up. There's now a recreation center for kids where that dangerous field was. And a very simple, very easy thing to do. We need simple and easy if we're talking about community level documenting their safety concerns. Also, I'm already talking about monitoring evaluation, which is my next topic, but there are other inexpensive approaches. So I'm not trying to do the hard sell on mapping. Maybe I am, but I love it. There's photographic documentation of safe and unsafe areas by citizens. You can have citizen scorecards, ratings of community assets. You can just pull together focus groups that examine and discuss. I did this once in Mexico. Took aerial and satellite photographs of an area called Chamula, and then I brought Chamula was, at the time I was there, a very long time ago, this is like early 90s, late 80s, early 90s, yeah. And I worked with them on photographs and said, where are your safety concerns in these photographs? You couldn't go into the area because they were having a revolution because the government was taking away their traditional way of living, replacing their maize crops with green revolution crops. So that's why they were all upset. And that's another example, not consulting the community. And then storytelling is another way. Another approach that everybody seems to jump onto, and I am an evaluator, I'm in the midst of working with surveys right now, but the thing is that surveys are all too common and not always effective. They're so popular with everybody. Everybody wants to do the survey. But people often answer questions, and it's not culturally the same everywhere. I have found this out. I've worked in different places around the world. You go into an American community, and they're all trained. Students sitting in class, no matter what I think and whatever favor this supplies for me, I will provide the truth of what I think about this. Here people say, what benefit am I going to get out of this? If I answer this way, what benefit will I get if I answer that way? And so surveys are not the same everywhere, all over the world. And it may not work so well here. And it's also limited to the assumptions made at the time of its design. So when I'm busy designing a survey, that's the first thing I have to do now, design a survey, and now I'm stuck with the assumptions that I'm living with at that time. Later on I find out, that question wasn't so hot, this one wasn't so good, because I learned later about the project. It's expensive too, and very time-consuming. So when you're trying to get back to the community with surveys, go, hey, we'll get back to you in a few months, we're still analyzing that data, the community's will and interest just drops. So obviously I've had a lot of experience with surveys, not that keen on them, but you can use them. As to mapping, my favorite thing, facilitation is required for that. You can work with NGOs, Department of Community Safety, municipal planning bodies, researchers. You can set up a system for mapping. Maybe you can even have the CPFs trained in supplying a way of mapping. I think a national body might be required to analyze the data when it comes back, but you have to be very careful with that one. But I'll talk a bit about it again, because I have to talk lastly about our last challenge, documenting progress and achievements. All good interventions have to have M&E. I'm sorry, I know it sounds prejudiced because I am a monitoring and evaluation specialist, and people have said to me, he just wants a job. But you know what? You have to do this. You cannot get away with not doing it. And we have to ask, with a monitoring system, are we sticking to or deviating from the safety plan? You can have a monitoring and evaluation specialist develop something for you that you follow. And then evaluation, did we really increase safety? And you have to measure this at 2 points in time. You do not have an evaluation if you come later on and do a review halfway through, or if you do a final evaluation. You have an assessment, really. But you haven't measured anything, because you have to do a baseline. Now, the challenges to M&E in South Africa is not enough people seem to know that it requires a pre-intervention baseline. The other thing people don't seem to know that it's a professional task. People are like, okay, let's hire the local high school student to do that one. You can't do that. It is a real professional task. There are other challenges. People fear evaluations and misunderstand what they're about. You see this poor lady here, she's like, they evaluating me? You run across that a lot when you go out to the field. So people have to, we do have a big issue here in this country with training people to integrate monitoring evaluation, saying it's okay, yes, we want to reflect. You often find that people just want to know whether the thing worked or not, even if it didn't work, what lessons did you learn? It doesn't have, you don't always have to win, and it's not necessary to fear the evaluation process. And evaluators are not personnel and performance appraisers, but they are social scientists trying to understand the outcomes. But the biggest single challenge, I'd say, is cost. When we talk about this community thing, how do we provide M&E at community level? If every community develops safety plans, who's going to pay for all the evaluations? That's a big task. Participatory evaluators can reduce costs. I'm one of those, participatory. You work with the community, you get the community to do a lot of the work, actually, and it's beneficial, it's better data, and you also reduce the cost at the same time. But tools are needed if this is going to take place across many communities. So what can communities do? This mapping safety, anybody can do it regardless of education levels. CPFs could do it. Simple maps need to be used. You might need an M&E specialist, you might need GIS, but it can give you the baseline and evaluation data for these community things. So these are the questions I've tried to raise that hopefully John will answer. Do we have an integrated system for communication on safety that allows for the very local community to identify, define, and express their own safety needs? As people identify their own communities, can they express their own safety needs? Is there a mechanism? Do we have pro-social ways of defining community safety that attract and excite people? Let's face it, we can't have boring processes with people all the time. You have to raise the bar and get people excited about stuff and what's going to go on in their communities. And lastly, do we have affordable methods to monitor and measure progress according to community definitions of safety? Do we have those methods? And maybe we do. Maybe I'm lacking on some information here. So now, next, we're going to go over 3 examples of creating local safety. And John Cartwright from the Department of Community Safety will conclude this talk, and he's also from the Center for Criminology.